After months of fear and uncertainty, thousands of Floridians living with HIV now have a temporary safety net. Governor Ron DeSantis signed a law reversing cuts that stripped thousands from a critical drug assistance program. But advocates tell our Capitol Bureau reporter Cody Butler the fight isn't over.
More than 10,000 Floridians living with HIV are now able to get access to life-saving medication.
People can now breathe a little easier.
A new law provides nearly $31 million to keep the AIDS drug assistance program running through June 30th.
It's not the perfect solution, but at least it's a Band-Aid to ensure people are maintaining access to life-saving medications.
State lawmakers unanimously approved the funding after the health department used emergency orders to slash the program. Those changes included reducing the eligibility from 400% to 130% of the federal poverty level, eliminating premium assistance, and removed medications from the program.
We certainly have been incredibly anxious over the fact that people living with HIV/AIDS in Florida weren't sure how they were going to get their medication.
Michael Rayner is one of the 30,000 Floridians in the AIDS drug assistance program to pay for expensive HIV medication. He says it's important that the legislature reverse all the cuts when lawmakers come back to Tallahassee to pass a budget.
People living with HIV, that don't have access to the medications and don't have access to doctors are going to end up in our local hospitals.
The reality is there are no alternatives. There are patient assistance programs that drug manufacturers offer, but those are temporary fixes.
State data shows there were more than 32,000 people living with HIV across Florida in 2024, and that number is going up. That's why the AIDS Healthcare Foundation calls ADAP a lifeline for the state.
We won't see any more treatment interruption. People will no longer have to ration their life-saving medication. Patients will no longer have that fear and anxiety.
The new law also requires the health department to update lawmakers and the governor on where the program stands every month. The first report is due next week. In Tallahassee, I'm Cody Butler reporting.